Hello and welcome to tonight's Roundtable. I'm Kate Burnham, the Superintendent of the Lunenburg Public Schools, and this monthly show will highlight my discussions with members of the school community about all the good things happening in the Lunenburg Public Schools. My guests this month are Carolyn Finch, our nurse leader in the public schools, and Jamie Millette, the social worker at the middle high school. Welcome, ladies.
Thank you for having us.
So our topic of conversation today is around behavioral health. Recently I pulled together a group of experts within the district to create a behavioral health advisory council. This team of experts will be able to advise me as to the needs of the district moving forward to make sure that we're meeting the needs of our students and families. So let's talk a little bit about that council. You're both members of that council, and your thoughts on that.
Sure. So we got together with all the stakeholders in our school community, guidance counselors, administration, nurses, myself, and we're really looking at what are our strengths but also what are our areas of growth when it comes to social emotional education and supporting our students with mental health.
We had a first meeting of this group just recently, and I have to say I was very excited about the conversation that was going on. It really is the equivalent of a vertical team for curriculum development. You know, if you parallel with teachers, this is more vertical teaming around the needs of students in terms of social, emotional, and behavioral health. So as part of that whole initiative, last year the district connected with Interface, which is a service that's available to our students, their families, and any resident of Lunenburg. Maybe one of you could jump in and start by giving some background about how we came to be part of this Interface connection.
Well, we learned about this William James College Interface Referral Service through an article actually in the newspaper about Leominster High School benefiting from this service when they noticed an increase in anxiety in their students, and that they found this referral service to be very valuable and helpful. So we did a little background information to learn about Interface Referral Service. It is through the William James College. It started in 2003 as a federal grant in Newton, and it was very successful there. So then they wanted to test it out in a more diverse community, and they tried it out in Waltham, I believe, and it was again very successful. And this referral service, which is primarily for mental health referrals, has grown since then and now serves several communities and has been very successful in those.
So how does this referral service work?
Sure, so it's a helpline, not a hotline, so that's a big takeaway here. Hotlines are more for crisis, 24/7. This is a helpline, so it's only open 9 to 5, Monday through Friday. Families can call, discuss what the needs are, what their insurance are, how far they're willing to travel, and they have a database of 8,000 providers. So this clinician will look through their database, see who's going to meet this family's needs, and then call them back within 2 weeks with some matches.
Well, that's a pretty substantial database.
It is. It's very big. It's across the entire state, too. So it's not just this area. It's across the whole state.
So, again, our students, their families, but any resident of Lunenburg can access this service. So what does that process look like if someone wants to access the service?
So they go ahead and they call the helpline, and they'll get in touch with a clinician case manager on the phone there through William James. They'll guide them through the entire process, take their insurance information. If there's issues with insurance, they actually will help guide them through the process. If they need to call someone else to get Mass Health, or what services are available to them based on their insurance. So they'll guide them through that entire process. They'll find a match in that extremely large database we just talked about, and then they'll call them back within 2 weeks with at least 2 matches. Following that, it is on the individual or family to make that intake appointment, but following that, they'll call back within 2 weeks to follow up, make sure it's a good fit, and make sure families are happy with the services.
Wow. They'll call back within 2 weeks, so the assumption is that they will actually have been able to connect with the healthcare provider within a 2-week window?
Yeah, they make sure they find providers that don't have a wait list, which is one of the biggest barriers to treatment in any community.
What's a typical wait list if I were to call on my own without this service?
Did you say 6 months?
Yeah, it varies, anywhere from 3 to 6 months.
Wow.
Yeah, it can be really long.
And not only that, but typically, too, if you were making this phone call without the use of this referral service, it's a very, very difficult process to navigate how you start from, I need help with my depression, to actually finding a provider who takes your insurance, who meets the qualifications, who doesn't have a year-long waiting list.
Right.
It's a very, very difficult process to navigate if anyone out there has ever tried to do that on their own. It's challenging.
Right.
Particularly for someone who is suffering with depression, as an example.
Exactly.
You might have the wherewithal to make the call one day,
Right.
but it may be difficult for you to be persistent
Right.
until you
Exactly.
secure
Yep.
a match. So that's a significant benefit, I think.
Absolutely.
It is. It surely is.
So when they call the helpline, what should they be prepared for? How long would that phone call take?
It's like 15 minutes.
Yep, 15, 20 minutes, and they just need their health insurance information.
Very good.
Yeah.
Yep.
That's easy.
And they'll speak with either a, I believe so, they use some of their graduate students from the college, as well as some of their staff.
Yep.
So that does help curtail some of the cost of this referral services, that they are able to utilize some of the graduate students in their programs. So that's a benefit as far as keeping the cost of this down
Right.
for people.
So is there a cost to individuals who take advantage of the service?
No. Nope. Town has contracted with William James, so there is no cost to the residents or students.
And the first year was funded through the school department, partly with grant funds, but it's a 2-year commitment, and we're working on funding for year 2. I know that there have been some fundraising events. Carolyn, why don't you talk a little bit about that?
Yes, I can talk about that a little bit. So when we were looking at learning more about the referral service, somebody from William James came to the Wellness Advisory Council. We thought that was a great place to learn more about it. It had the right types of people, a pretty diverse group, and people that would be interested in the mental health and social emotional needs of our students and community. So the Wellness Advisory Council sort of became that person who was trying to accomplish getting this service for the town. So we were able to do a fundraiser at the Stillman's Fair this past, I guess it was in September?
September.
And we were able to raise $2,295 that we were able to give towards this. And then since then, there's been another donation made by the Lunenburg Family Practice through the Stewart Company of $500. So we are trying to raise some money to pay for the second year of our 2-year contract.
Very good. Do we know of any additional fundraising efforts planned for the rest of the year?
Not that I'm aware of. I don't think so.
Yeah, we're still, I think, trying to figure out how we're going to come up with the funding for next year.
Right. And if anybody wanted to make a donation as an individual, that's acceptable?
Yep.
Absolutely.
Yep, they can send it, I believe, to your office. Right.
So, what makes this commitment to funding this program, this partnership with William James for 2 years, so important to us as a school community?
Sure. Mental health concerns are on the rise. Statistically speaking, and this is across the country, so it's not just affecting our community, it's everywhere. 1 in 5 students suffer from a diagnosable mental health disorder. Most of those students don't receive treatment. So we can do the best we can. We can provide as much support as we can in school. But it does get to a point where students do need some outside support, whether that's medication management services, outpatient therapy, in-home therapy. There's a lot of needs for families and students and individuals in our community. Mental health doesn't discriminate. It affects everyone, everywhere, and it's on the rise statistically. So it's worth our while to help address and support people in our community.
So we see things on the rise. Give an example for viewers of what that looks like in the schools. What kind of students are coming to you?
There's definitely an increase of students coming to either of us, actually, in the health office or through our student support team. They get hooked up with, a clinical social worker for addressing their rise in feeling anxious. Anxiety, I would say, is the #1 thing that I see more of now than I've ever seen.
Yep.
Students are so anxious they have panic attacks or anxiety attacks frequently throughout the day and aren't able to be in the classroom and able to learn. And so it's huge. It's a big need.
It impacts kids' ability to access curriculum and be successful students at the end of the day.
Right.
So it's important that we address these issues and help support them.
Right, because clearly if they're spending time in either of your offices, they're not in classes.
Exactly.
Right.
But beyond that, students who suffer with anxiety, as an example, have a difficult time focusing, staying on focus.
Right.
Which, even if they're in a classroom setting, is going to impact their ability to learn.
And they're also at an age where I don't think they know how to manage it. It's difficult for them to figure out how to manage this anxiety. So I think they need as much support in that as possible. And as a school, we can support them as much as possible, but it really needs long-term, a very healthy approach to treating this anxiety. And the concern is that if they're not able to get that, like into a therapy or some other type of modality for their anxiety, that they'll find other alternative ways to cope with the anxiety that are less healthy, like bad behaviors or, substance abuse, cutting. So that's the other thing, is that, trying to help them find a good alternative way to manage their anxiety.
Which is vitally important. So I know that we've only been using this service for a handful of months at this point.
Right.
But are you seeing any impact to the way that you're working, having this service available to you
Sure.
to refer families to?
Absolutely.
Yeah, it's been really helpful. Anytime I have a conversation with a family member, saying whether it's a parent or they have another child in the home struggling, I have the ability to hand them this interface referral system, and it's so helpful, because otherwise I'm having to tell people I got to call back. I'll have to try and navigate by calling some agencies, some private practices, see if they have a wait list, do they take the insurance of the family, and that takes time out of my day, and I can't always get back to families quickly. So this has been very, very helpful. The families that have used it have said it's been very easy, and some have actually gotten hooked up with services and have continued to utilize that provider.
Which is great.
It's great, yeah.
Will we be able to get any data relative to how many folks are using it, whether it's families in town with students or folks who just live in town and don't have children in the schools? Will we be able to get data?
We will. William James will provide us with data twice throughout the year. So I believe we're coming up to the first round of data that will be provided, and that will show what age group is accessing the helpline. Not necessarily, I don't think, if they'll continue services, but at least if that initial call was made. So we'll start to get that information soon.
That's great.
And I think it's important that people know about it and spread the word about it, that it's available to every member of the community for the town of Lunenburg, not just the students in the school, but every member of the town, as well as students who attend Lunenburg schools, even if they don't live in town.
Exactly.
So and it's free.
Right.
Another point that I forgot to mention earlier was that the entire process is confidential. And I think that is important to note, because it is hard for families to reach out for help around these sensitive issues. So the entire process is 100% confidential, and when the data gets reported back to us, it will be presented in a way that remains confidential.
Good. Very good. So If we have a single message to leave with viewers today around the interface service or behavioral health in general, what would you like that message to be?
I think that this is a service, it's a great service that we're able to provide for every member in our community, and I think that people should take advantage of that and not be embarrassed or not know what to do with their feelings around their anxiety or their depression or whatever their issue is that needs help. I think that the more the people that take advantage of this, the healthier our community will be.
Particularly relevant, I think, at this time of year with the holidays.
Yes.
Yeah,
absolutely.
It's a tough time of year, and I hope that families take advantage of this because it is going to help us be a healthier community. It's promoting general wellness to everyone. So I'm really excited about it, and I hope that people take advantage.
So if people want to take advantage, how can they connect with Interface? Where can they find information?
It's listed on our district webpage. And it might be easiest to find, actually, when we tried to look for it the other day for somebody. It's easiest to find, I think, if you go to the Lunenburg High School page, because it's right on that front page, because otherwise there was a couple tabs you had to go to get it. But they could always call the school, too, if that's easier for them, if they don't have access to our webpage. If they call the health office of any of the schools, or they could call Jamie at the high school, and we could provide the phone number.
Fire and police also have access to the service. Eagle House in town. I'm trying to think who else. The Teen Center, the Boys and Girls Club. We've reached out to a variety of different stakeholders in the community. So a lot of different individuals, have access to this service and will be able to provide information. So you can either call the school or you can reach out to one of those entities as well.
That's great. Well, this was a very important conversation to have, and I think pretty timely, too, given that the holiday season is upon us. So hopefully those folks who are viewing today found this information helpful, and potentially many more find it to be a benefit that they'll actually be able to avail themselves of. So thank you both for joining me today. Appreciate it very much.
Thank you.
Thanks.
Thank you for tuning in, and we'll see you again next time.